or any kind of alopecia, whether it's a genetic or whether it is because of some injury or something like that. So in those cases, we can plan for a hair transplantation.
Is there any age limit, like one can do a hair transplant?
So basically, hair transplantation is done mostly for the androgenetic alopecia cases, like those are genetic hair loss.
ആഡ്സിലും പ്രൊമോഷൻസിലൊക്കെ ആണുങ്ങൾക്ക് മാത്രമാണ് ഈ ബോൾഡിംഗ് ഇഷ്യൂസ് ഒക്കെ ഉള്ളത്. സ്ത്രീകൾക്ക് എന്താണ് അത് സംഭവിക്കാറില്ല?
So how many females get bald? So its percentage is very less. Whenever you talk about female pattern hair loss, it's more of thinning.
What would be the average cost of the surgery for a hair transplant surgery?
Whenever I talk about hair transplantation, I always say it's an art. What you do surgery, normally you just have to get rid of that organ which is damaged. Okay, this is not that kind of the surgery.
എന്തൊക്കെ റിസ്ക് എലിമെന്റ്സ് ഉണ്ട് ഒരു സർജറി, ഈ ഒരു ഹെയർ ട്രാൻസ്പ്ലാന്റ് സർജറി ചെയ്യുന്നതിന്?
This is a very minor risk surgery, to be honest, because we are just dealing with the skin part. But the only problem with the hair transplantation is the long duration. If the local anesthesia doesn't sustain for a longer period of time due to some issues, like see, local anesthesia is not a highly skilled anesthesia, but the duration you have to maintain is very important.
ഇപ്പോൾ റീസെന്റ് ആയിട്ട് ഹെയർ ട്രാൻസ്പ്ലാന്റേഷൻ ഇഷ്യൂസ് വന്നത് എന്തുകൊണ്ടായിരിക്കും അത് സംഭവിക്കാൻ കാരണം?
It's a case of Negroizing Facialis, basically a flesh-eating disorder where is a very severe bacterial infection where the skin is get damaged very fast.
നമസ്കാരം. ഹെയർ ട്രാൻസ്പ്ലാന്റ് മൂലം കുഴപ്പത്തിലായ സനലിനെ നമ്മൾ വാർത്തകളിലൂടെ അറിഞ്ഞതാണ്. എങ്ങനെ ഒരു മികച്ച രീതിയിൽ ഹെയർ ട്രാൻസ്പ്ലാന്റ് ചെയ്യാം, അല്ലെങ്കിൽ അതിൽ മുന്നും പിന്നും ശ്രദ്ധിക്കേണ്ട കാര്യങ്ങൾ എന്തൊക്കെയാണ്? ഇതിനെക്കുറിച്ചൊക്കെ ചോദിച്ചറിയാൻ നമുക്ക് ഡെൻസിറ്റി ഹെയർ ക്ലിനിക്കിലെ ഫൗണ്ടറും ഹെയർ ട്രാൻസ്പ്ലാന്റ് സർജനുമായ ഡോക്ടർ ഗജാനൻ ജാദവ് നമ്മോടൊപ്പം ചേരുന്നു. ഹായ് ഡോക്ടർ.
Hello, hi.
ഇപ്പം ആഡ്സിലും പ്രൊമോഷൻസിലൊക്കെ നമ്മൾ സാധാരണ കാണാറുള്ളത് ആണുങ്ങൾക്ക് മാത്രമാണ് ഈ ബോൾഡിംഗ് ഇഷ്യൂസ് ഒക്കെ ഉള്ളത്. അപ്പം സ്ത്രീകൾക്ക് എന്താണ് അത് സംഭവിക്കാറില്ല?
So how many females get bald? So its percentage is very less. So you must have seen only males are getting bald, females are not getting bald. So whenever you talk about female pattern hair loss, it's more of thinning. They usually don't get bald. So whenever we think about a hair transplantation, 90 to 95% patients are usually male and only 4 to 5% patients are female. So females, whenever they get a lot of thinning all over the scalp, that time only we consider them for a hair transplantation. Otherwise, most of the females doesn't require hair transplant.
And what kind of maintenance do you suggest, to prolong the results of a hair transplantation?
So when we say hair transplantation, usually those hair are permanent zone or the area where we can have a longer period of life of those hair, only those hair are picked up. So whenever we do hair transplantation, usually transplanted hair doesn't require much of support because they are genetic resistant as well as they are hormonal resistant. But if somebody is having a poor lifestyle and not having proper diet or having some comorbid conditions, in those conditions we need to supplement those also because those are live hair. It's not like that they are nylon hair and not going to degrade or something, nothing is going to happen with them. They are also live hair. They also require good quality nutrition and other like maintenance as whatever you require for your normal natural hair. Okay, so it's nothing special, but normal healthy lifestyle is required for the transplanted hair as well.
So first and foremost, I would like to know who all should actually go for a hair transplant surgery.
Okay, so we need to understand why the hair transplantation is there. So when we consider hair transplant, that's like you must have seen like doing kidney transplants, liver transplant. This is kind of hair you are transplanting to a area where there are no hair. That means there are no hair follicle present. So somebody, when we say it's a bald, that means there are no hair roots, hair follicle present. So with the help of medications, we are not going to grow any kind of hair. That time we plan for a hair transplantation. That means it's called alopecia or any kind of alopecia, whether it's a genetic or whether it is because of some injury or something like that. So in those cases, we can plan for a hair transplantation.
So can the transplanted follicles grow like normal hair? Like
Okay.
That's people have doubts in that. So can you clarify that as well?
Oh yeah, so many patients ask me whether doc this will be growing hair or I just once we grow that then you cannot cut or something like that. There are a lot many questions. It's very genuine question what you asked me. So we transfer the follicles from the donor area, which is our backside, to area where they don't have any hair follicle left. So these follicles have a capacity to regenerate. So you must have seen everybody losing hair, but not everybody is getting bald, right? So why some people are only getting bald, not the others? Because over the period of time, they keep on losing the hair, they keep on losing the size of the hair follicles. One day the size becomes very small that they could not regenerate the hair. So when we transfer the hair follicles or hair roots, we are transferring along with the stem cells. So these have got a regenerative capacity. If you cut also, trim also, shave it off also, again they are going to grow. And even if they falls also, they will also have a regrowth. So these follicles are very, very strong and they are resistant to your genetic as well as your hormonal actions. So these are called actually a permanent zone and permanent hair.
And is there any age limit, like one can do a hair transplant?
So basically, hair transplantation is done mostly for the androgenetic alopecia cases. Like those are genetic hair loss. So usually you get bald approximately at the age of 25 to 45. So if this is the period where you require those hair and you require hair transplantation in that particular area. So when we talk about hair transplantation, nowadays guys are getting bald around 17, 18 also. So we are suggesting we can plan around 20 years of age and there is no upper limit. Even I have done a hair transplantation for a 78 years man who wanted to have a hair. So only the criteria for hair transplantation is that you should have a donor area. The hair should be there on the back side of your head.
ഇപ്പോൾ ഒരു ഹെയർ ട്രാൻസ്പ്ലാന്റ് സർജറിക്ക് എത്ര ദിവസം വേണം? ഒരു ലൈക്ക് 2-3 ദിവസം വേണോ അതോ എത്ര ദിവസമാണ് ആക്ച്വലി ഇതിന്റെ ഡ്യൂറേഷൻ വേണ്ടത്?
So it's all depend on two things basically. One thing is what is the area you want to cover. Whether it's complete bald grade 7, like there are grades from grade 1 to grade 7. Grade 1 is just one finger and grade 7 is completely bald from the front to back. So if you're planning for a complete coverage, then might be you require more days to cover it. Or either if you have only like a suppose 4 finger of transplantation to be done on the front area, it usually done within the 6 to 8 hours. But it also depends on the team, the expertise what you have, the doctor experience you have. So probably a experienced team and with the experienced doctor, usually 4 finger or up to grade 4 transplants can be done around 6 to 8 hours. Those are taking maybe 2 days or 3 days for the surgery. Either they are not having a good team or their experience is less. That's what they are requiring more time to perform the surgeries. So up to 4,000 graft surgery we probably can be done in 6 to 8 hours. But more than 7,000 graft surgery, it might take 2 days to perform. But those centers might be taking 4,000 graft 2 to 3 days, then that might have a less experienced team for this.
Now coming to the pricing of the surgery, so people have a lot of doubts about it, whether it's affordable for normal people. So what would be the average cost of the surgery for a hair transplant surgery, and is there any factors that would influence this price?
Yeah, obviously. See, whenever I talk about hair transplantation, I always say it's an art. It's not like routine surgery, what you are doing, like appendicectomy or other things, what you do surgery. Normally, you just have to get rid of that organ which is damaged. Okay, this is not that kind of the surgery. Here, there is a precision, there is artistic look because everybody is having a different facial structures, different facial zones also. So, what kind of hairline suits to that particular person is completely different from other person. So that way, it's very, very minute detailing surgery. It's a superficial surgery, it's a low risk surgery. But when you talk about the detailness, it's too detailed. Okay, you have to think about a single hair, how we can place those hairs so that it should look more natural. So it's really very, very important to understand that how the natural hair transplantation should be and whether this hair transplantation is going to look like a natural on your head. So that is going to be the deciding factor for the success of the hair transplantation. When we talk that hair transplantation should not be detectable, like whenever somebody comes to you and see your face, you should not recognize that you had a hair transplantation. Yeah, definitely it depends on other factors also, like a patient's hair quality and texture and as well other things as well. But definitely we try to maintain that naturality so that it should not be get detected. That's one thing. So when we talk about The pricing factor. So doctor's experience is very, very important. His qualification is very, very important. And the team support what we have along with the clinic infrastructure. These are the factors going to definitely decide the pricing of it, because doctor's experience will decide naturality of the hair transplantation. His qualification will require for the safetiness of it. The team and as well as the clinic required for the infrastructure as well as the outcome of the surgery. If something goes wrong during the surgery, there has to be a team which can support the emergency conditions, as well as should be an infrastructure like oxygen, the emergency crash cart, the maybe a defibrillator you might require. So this factor helps to have a better outcome and ultimately going to affect your pricing as well as. So when we consider in India, there might be a range from 25 rupees per graft to up to maybe a 700 rupees per graft I have seen, like people are charging. So it's all depend like how much the doctor want to charge according to his experience and the expertise in the field. So, but on an average, I can say a good doctor with a good experience, you might cost around 50,000 to up to 2 lakh rupees.
ഇപ്പോൾ ഇതൊരു മൈനർ സർജറി ആണെങ്കിൽ പോലും എന്തൊക്കെ റിസ്ക് എലിമെന്റ്സ് ഉണ്ട് ഒരു സർജറി, ഈ ഒരു ഹെയർ ട്രാൻസ്പ്ലാന്റ് സർജറി ചെയ്യുന്നതിന് മുന്നേ അല്ലെങ്കിൽ അത് ചെയ്ത് കഴിഞ്ഞിട്ട്?
So ideally, this is a very minor risk surgery, to be honest, because we are just dealing with the skin part. But the only problem with the hair transplantation is the long duration, because the surgery usually lasts for 6 to 8 hours, and for that purpose, you need to give local anesthesia. If the local anesthesia doesn't sustain for a longer period of time due to some issues, like see, local anesthesia is not a highly skilled anesthesia, but the duration you have to maintain is very important. When some patient complains about repeated pain and the expert person is not there to understand what is happening with the patient, why he is getting repeated pain, that time people or the technicians or the doctors who are not experienced into it try to inject more anesthesia, and which cross the limit of your safety margins. When you cross the safety margins, then the chances of high risk are very, very high, because anesthesia might cause some patient have seizures or convulsions or fits. Some might have got cardiac problems along with it if you overdose it. So this complication you should be able to tackle it. Either first of all, you should not cross the safety limit, and if you cross it, then you should have that team to tackle the problems. So that is very, very important. So whatever the issues we have seen, like recently in some cases has happened, that is because of doctor is not experienced enough to handle the complication of the anesthesia. So they were not aware of how much dose should be given, what is the weight of the patient, accordingly how much dose we can give the patient. And surgery is performed usually for 2 to 3 days repeatedly, and maybe see, once you give anesthesia, there should be gap of 24 hours before you again try to give inject. So some centers are doing like within 6 to 8 hours again second session. So that is not a right way to do it. So they should get first trained how these things can be tackled, and then they should try to do hair transplantation, because experience, what I feel, is very, very important in hair transplantation. Being a very low risk surgery, you tend to make it high risk by not having the knowledge of anesthesia and how the things works. Because long duration surgery, there might be little bleeding, more bleeding, there might be hypovolemia, there might be a dehydration. So you must able to understand what are the physiological changes happening to the patient because of long duration of the surgery. When you don't understand these things, then you tend to risk the patient's life. So this is very, very important. I just want to mention here. And other things are very, very, very superficial things are there, complications. There might be a forehead swelling, there might be little heaviness in the head for first few days, there might be some pimples, there might be some numbness. So these are very like a little you can say complication, or very minor complications you can get it, but these can be easily solved. But the complication what we have heard nowadays, these are something which is very, very unusual, will not happen to a reputed or a good clinics, because they are following all the protocols of hair transplantation. So my request for the doctors and the patients as well as, doctors should get trained first themselves to tackle all this issue, and should not arise this issue first of all. And patient try to choose a good clinic where doctor is experienced.
അപ്പോൾ ഈ ക്ലിനിക്കിൽ എന്തൊക്കെ സേഫ്റ്റി മെഷേഴ്സ് ആണ് ഫോളോ ചെയ്യുന്നത് ഒരു സർജറിക്ക് മുന്നേ നമ്മുടെ OT-യിലും അവിടെയൊക്കെ എന്ത് മെഷേഴ്സ് ആണ് ഫോളോ ചെയ്യുന്നത്?
Yeah, coming to that, this is very actually a point where everybody's talk about. So today, as per the guidelines of there are two basically councils. One is National Medical Council, which regulates your MBBS and other degrees, and there is a Dental Council of India, so that regulates dental part. So there are two different councils in India. So National Medical Council says a plastic surgeon, a dermatologist with an experience, or any registered medical practitioner with an experience of hair transplantation can do hair transplant surgery. So when NMC mention its experience, is very important. See, plastic surgery is a super specialty. They do have MBBS, then they do a MS, and then after that they have a MCH. So the duration of experience is very huge. So usually they know each and everything in a detail. But when an MD physician or MD dermatologist is doing surgery, or any MBBS with a special qualification in a hair transplantation, there might be some courses like international courses, as well as those who give a training in hair transplantation. So these guys need to get trained very well. They should have an experience of doing hair transplantation, at least 500 hair transplantation. I always say you should do before you practice independently. So you should have to practice hair transplantation under somebody who knows hair transplantation in and out, even dermatologists, because most of the dermatologists doesn't know hair transplantation, because that is not an integral part of their curriculum. They know hair physiology, but surgery is not an integral part of dermatology. Whenever we say dermatologists to do hair transplant, they have to get a special training for that. Like the way MS general surgeon, they know how to do an appendectomy, they know how to do a breast surgery, but they don't know how to do a laparoscopic. Okay, whenever they plan to start their own practice in a laparoscopy, they usually get trained themselves under somebody who has the knowledge of it, who has the good experience of it. Once they get trained themselves under somebody, then only they practice doing laparoscopic surgery. So laparoscopic surgery is not a different field. It's an additional specialty of that field, basically. So the hair transplantation is an additional specialty of the plastic surgery or dermatology, where you have to get trained yourself. So when you get trained yourself, then it is more easy for you to perform this. So basically, these two faculties are into it, and government says they can do it. One more faculty is MDS, maxillofacial surgeons. Even the Dental Council of India permits them to perform a hair transplantation, but even for them also I say this is not their internal curriculum. They don't have a much specialty into it. They also should get trained properly before they come into hair transplantation, so that these incidences can be avoided.
ഇപ്പോൾ ഒരു സർജറിക്ക് മുന്നേ എന്തൊക്കെ പ്രോട്ടോകോൾസ് ഫോളോ ചെയ്യണം, അല്ലെങ്കിൽ എന്താണ് ഒരു സർജറിക്ക് മുന്നേ ഫോളോ ചെയ്യേണ്ട ടെസ്റ്റും കാര്യങ്ങളൊക്കെ, അത് ഇവിടെ ഫോളോ ചെയ്യുന്നുണ്ടോ?
First of all, we need to find out what is the reason for the baldness. So there are different reasons for the baldness. Most common is androgenetic alopecia. Other are like cicatricial alopecia. There is alopecia areata, and other things are there. So we need to understand what is the reason. For that purpose, we need to have some test. Basic test is trichoscopy, what we analyze the scalp condition as well as hair condition under microscope. That is one thing. Second thing, like there are blood tests. Blood test starting from your hemoglobin up to the thyroid and vitamin D deficiency. So we do all these blood tests whenever we plan for a hair transplantation, because we don't want to have any undue effects of this condition on your hair transplantation. So we do all the tests before we plan for any surgery.
So you mentioned that there are a lot of protocols to be followed.
Yes.
So how does this clinic ensure that, or adherence, that all these protocols are met, and what is the safety measures taken before the surgery is done?
So you must have seen there are so many hospitals running over the period of years, or I can say over the period of decades. So I've been like qualified from Tata Cancer Hospital. I've done my anesthesiology from there. After that, I've done my dermatology. I'm a person who has got double qualifications like anesthesia and as well as dermatology. But when I've seen my college, like Tata Memorial Hospital, it's been 100 years it's working. So they're based on the protocols. Whoever the new doctors come, they have to follow that protocols so that things will not go wrong. So here also in large density, we follow all the protocols. There is a specificity, like this thing has to be done this way only. Nobody can do a shortcut or nobody can bypass those protocols. So the safety measures are always there. When you start with any hair transplantation, there's a test dose has been given to the patient. We put an IV cannula to each and every patient to get prepared yourself. If something goes wrong, there has to be an IV access to give some injections, emergency injections. So we take care of that initially as well. And we do all the blood tests. We do find any complications can happen during the surgery. Any patients with the comorbid condition, like somebody is diabetic, we check his HbA1c, fasting postprandial, and some patients are like hypertensive, some patients are with the post bypass surgeries also, we have done hair transplantation. So we take care of that things, that we should have all the emergency things ready if something goes wrong, and there's a protocol how to go ahead with all these patients. And we have a very fast team who performs surgery, usually finishes surgery of up to 3,000 to 4,000 grafts within 6 to 8 hours.
So in this clinic in large density, do you also perform correction surgeries?
Yeah. So see, hair transplantation, whether it's a first time patient coming or it's coming for the fourth time, whatever possible for the patient, we need to do it. And we have operated so many patients. We have been done transplantation somewhere else, and that's the routine part of my practice, because I've been experiencing so many years. So I am mostly doing all the correction surgeries, because people look at me for that purpose only. If they want to do a first time surgery, they usually prefer other doctors, but they want to do a redo, they don't want to take any chance. They come to me and they ask me, "Doc, you need to do the surgery now."
So if someone wants to do a surgery, what should they go for? Should they choose a clinic first or based on the doctor?
See, to be honest, I say that like hair transplantation doesn't require much infrastructure. Okay, basic infrastructure is good enough if doctor is qualified and experienced enough. So I always going to prefer a doctor rather than a clinic. But if you're planning to do a surgery where, like suppose some doctors don't have dates, like some doctors are really charging maybe a enormous amount to somebody, then that time you can choose a clinic where the clinic has got good reputations and experience enough doctor to perform your surgery. Because I feel, yeah, this is a minor surgery, this is not very high risk surgery, but ideally doctor should be the first choice. And if you cannot afford the doctor, then that might be a second choice, will be a clinic, branded reputed clinic.
ഇപ്പോൾ നമ്മുടെ സെലിബ്രിറ്റീസിലോട്ട് വരുവാണെന്നുണ്ടെങ്കിൽ നമ്മൾ കേട്ടിട്ടുണ്ട് സാജൻ സൂര്യയുടെയും വിഷ്ണു ഉണ്ണികൃഷ്ണൻ്റെയും ഒക്കെ ഈ കറക്ഷൻ സർജറീസ് ഇവിടെ ചെയ്തിട്ടുണ്ട്, ഡോക്ടർ ചെയ്തിട്ടുണ്ട് നമ്മൾ കേട്ടിട്ടുണ്ട്.
No, so try to understand. Usually celebrities does their surgeries with a very well-known doctor. They usually have a good feedback about that doctor, and then only they go to that doctor. They don't try and test somebody else which is not known to them. That is one thing. Second thing is that doctor's credibility is established already into the market. And third thing might be that doctor might be a little maybe expensive for the normal person to do a hair transplantation. So, but the basic is same everywhere. Whatever the surgery you are doing for a transplant, celebrity as a hair transplantation, if you are doing to the normal person, the things remain same. The science is same everywhere. It's only the person's hand who is going to perform the surgery which decides the outcome of the surgery. So those celebrities which are on celebrities like on the camera all the time, they need to have a good looking hair transplantation which should not be detectable.
Should be looking more natural.
Yeah, more natural, because they're under lights all the time and they're very high density cameras are looking at them, they're focusing on their hairline. So these people usually take care that this doctor should be experienced enough so that they can give the natural look to the patient. But normal doctor, which is even not a celebrity doctor, even he can provide you the good results if his experience is good enough.
So what advice would you give someone who's, who wants to go for a surgery now? Because there are a lot of allegations going on and a lot of controversies, a lot of issues going on right now, the scenario, right? Now people are a bit more skeptical about, how to go about choosing a doctor or a clinic. So if somebody wants to go through a surgery, like what advice would you want to give them?
First of all, whether you really require a hair transplantation. That's very, very important. So there are few like patients coming to me like at the age of 22 years, doesn't have much baldness. They can easily cover their baldness with little change in their hairstyle. Still, they want to go for hair transplantation. These are not an ideal patient. I don't suggest them to go for a hair transplantation. Yeah, but if your baldness is so visible that you cannot afford it, or you cannot just cover it with your long hair, then definitely you are a patient for a hair transplantation. Then you can plan for hair transplant. Then a doctor who is into it since so many years, maybe 10 years of experience, who is doing on a daily basis hair transplantation, who has at least done 500 hair transplantations, and the clinic is having good reputations, good follow-up services as well. So these are the factors we should consider. And one more factor I would say, ethical doctors. The person who really requires hair transplantation, only those patients should be posted for hair transplantation. Those doesn't require, or those can be managed with the medical management like minoxidil, finasteride, PRP and other treatments. Those can be treated with those medications as well. I've seen recently one patient did a hair transplantation somewhere. He had a complete hair on the forehead. Still, somebody pushes him for hair transplantation where it was not needed. And then after hair transplantation, he has complete facial edema, swelling everywhere. He could not open his eyes and all. So I don't know whether the person who has done a transplant for him, whether he was a doctor or not. Because first criteria to have a hair transplantation is a baldness. If you don't have baldness, how you can post for a hair transplantation? So we have to be very careful while you are thinking about a transplantation, where you are choosing a doctor. He should have that experience when to plan for hair transplantation.
So we've heard that we've seen people going to another country, like for example, Turkey for hair
transplantation and plastic surgeries. Yeah.
Why not India? Why are people going there and doing it? Like for example, for skin, we've heard people going to Korea and doing it. So like that.
See, we Indians are very fascinated about foreign countries. First of all, that is always there. Like everybody is like a pro-Western. We want to follow their culture rather than our culture, one thing. Second thing is, Turkey is based in the Middle East, where everything is like close to them. Like even France is close to them, UK is close to them, and other like European countries are very near to them. So one thing, like if you plan to do a hair transplantation in US, you have to spend at most 20 lakh rupees for hair transplantation. So Turkey has come up with a scheme where they will have like complete package, where a stay as well as hair transplantation is included in that package. They might cost around 4 to 5 lakh rupees. So one major factor is the price, where the people who cannot afford in US, UK and France, they probably plan to go where medical tourism is there. Like India is also getting popular for the medical tourism, like Ayurveda and other cancer surgeries and all. Like most of the Asian countries refer patient of them to India because having like affordable one thing, and we have a very good skilled doctors. So to be honest, Turkey is now a grey market for hair transplantation. Grey market means that there is no doctor who is performing a hair transplantation. They are just doing advertisement. They are just giving packages like sightseeing, tourism, along with the stay and everything. And most of the surgeries are done under guidance of maybe a doctor, or there is no doctor in the clinic. Because the last year there were 22 deaths in Turkey because of plastic and hair transplantation. One guy committed suicide because of beard transplantation, which was done by a non-medico. The guy of 24 years of UK guy who committed suicide because of wrong hair transplantation. So these things are coming up, but you know the foreign media is very strong. They don't share these things with the other medias. But being a doctor, we know our colleagues are there. They are sharing these things with us. So, but Turkey is not a good market nowadays because they most of the time don't speak English also, and they are not that cooperative to Indians as well. So we do have India good doctors, skilled doctors, experienced doctor. Only you need to find them where they are located.
The right doctor.
Right doctor.
ഇപ്പോൾ റീസെൻ്റ് ആയിട്ട് നമ്മുടെ ഹെയർ ട്രാൻസ്പ്ലാന്റേഷൻ ഇഷ്യൂസ് വന്നായിരുന്നു സനലിൻ്റെ കേസിൽ. അപ്പം എന്തുകൊണ്ടായിരിക്കും അത് സംഭവിക്കാൻ കാരണം?
So to be honest, I have not met the patient, but whatever I have heard from the news and the media, it is a case of Negroizing Facialis. Basically a flesh eating disorder where there is a very severe bacterial infection where the skin get damaged very fast. So whenever you feel any complication is there, right time to act is very, very important. So that time is very crucial. Whenever the patient start complaining about any pus discharge or any pain in the surgical area after surgery, usually the whatever the wound is there, whatever the grafts are there, usually get healed by 10th day. Whenever we see that there is a delay in the healing, there is some pus is coming out of it, or the things are not getting right in the right direction, we have to intervene. So when we thought, or somebody must have thought about having a chance of necrotizing fasciitis, that time patient should have been admitted, should have been given a proper IV medications. The we can say the pus culture has to be done to find out what kind of organism were there, and what kind of antibiotics can be administered so that we can control that infection within that stipulated period of the time. The thing is that when the things were very severe, after that only they could recognize that this problem was there. So this problem is basically because of the poor sterilization technique and poor infrastructure. And this surgery was done for 2 days. Most of the times the patient go to home, they don't take proper care, they roam around, that bacterial infection get deposited within the area of whatever the transplantation is done. Again, the second day the same surgery is being carried out, and that creates the complications more. So it's very important that you should try to pick up the problems early so that you can intervene. See, complication is a part of any surgery. It's not like that if I am doing surgery, I will not face any complication. Any doctor who is performing surgeries can face a complication, but it's very, very important that you should pick them at a proper time so that you can intervene and you can solve the problem. So that time, I think the delay in the treatment is a major culprit rather than anything else.
Coming to your experience, can you throw some light on your experience about some surgeries, how many surgeries you've done, and about the franchisees of Dentis?
See, we don't give any franchise. These are our own clinics.
Mm-hmm.
Okay, so we have our own protocols and strictly followed all over the places wherever we have the centers. And we train our doctors initially for first 2 years, and then we ask them to do a surgery. Otherwise, they are not independently given the surgeries. So these kind of protocols we follow. See, I am a double degree holder where I do have experience in operation theatre, critical care and anesthesia as well. So that is the reason that I am able to manage all these centers, because we do have a strict protocols, because I was a part of a critical care team, anesthesia and OT. So for 10 years, I do have experience in that field, being a anesthesia degree holder. And after that, I did my dermatology as well. So I do have a combination of the both things. So that way I have formed the protocols in our clinic where things should be done in a proper way and protocolized way, so that there should not be any complications. So I've done more than 5,000 surgeries till now, over the period of at least 10 years dedicatedly, and before that also. But last 10 years I am only doing hair transplantations. And if you ask about large density, we have done more than 10,000 surgeries in total in large density.
And where are the branches located?
So we do have Kerala 3 branches, again in Bangalore 2 more branches, in Maharashtra we do have branches, and we are starting one more branch in Dubai soon.
All right. Thank you so much, Doctor, for sharing your thoughts and clearing most of the doubts that people have. Thank you so much.
Thank you very much.